Yo, what is happening, bro? What's up, everyone? My name is Dr. Mo, and I'm a dentist. Let's watch the removal of that humongous, huge dental calculus on the teeth. That is crazy. So, of course, it looks like a really severe case, to be fully honest, of dental tartar on the teeth. It's not very common unless if you're a periodontist or a perhaps even dental hygienist who very often works with a severe case like this. It's not very common to see cases like this. That's why I picked this video for you. And look at that huge dental tartar on the front teeth. Looks like they are the dentist here is scaling the lower. They're going on with the molars, premolars, and sometimes that dental tartar would get stuck in the occlusal surface of the teeth, like you saw in those premolars. Looks like they're proceeding to the front or anterior teeth right there. Looks very interesting. Watch till the end because there are gonna be some surprises, by the way, in this video from the dentist view. What you're watching right now is technically a dentist view. This is what we see when we're doing cleaning to your teeth. And trust me, I don't want to say most of you, but many of you, that's probably like your case is not that bad, like not that severe. Oh God. So as you can see, of course, there's a very high likelihood for bleeding to occur as those huge pieces. What are you doing? Oh, no, the whole tooth just popped off, and that can happen during dental scaling. Okay, so I'm just gonna address, whoa. Look at all that dental calculus. Okay, I'm just gonna address why does that happen so that it would not happen to you in the future. As gum disease and periodontal disease advance in relation to all of that dental calculus and dental tartar, and even perhaps medical diseases a person may have, like diabetes and so forth, there's a lot of bone loss, and bone is supporting the tooth, keeping it in place. As bone loss occurs, that tooth becomes mobile, like what you saw, and you may lose it. I wouldn't be as aggressive and push it that much unless if I had a discussion with a patient about like some teeth may fall off, and normally that is addressed like during the process of consent form and explaining the procedure. Anyway, so the dentist here is continuing casually with the dental cleaning, and there are some stains on the tooth that the dentist is removing. And look at how they focus in using that instrument. By the way, it's called, or device rather, it's called an ultrasonic scaler with water cooling, which is very typical for dental cleaning case. And they use the tip particularly to help remove all of those stains, because as you can see, it's not only dental calculus or dental tartar, also there are all of these stains that should be removed, and the tip of the ultrasonic scaler really plays an important role in removing all of these. As I said, of course the gums are going to be inflamed and it's slightly swollen and reddish around these teeth in place where the huge dental calculus existed. Of course, there's a misconception that someone is going to have, for example, teeth mobility. They think it's because of the dental scaling. It's not because of the dental scaling. It's because of the periodontal disease, the gum disease, all of that huge dental calculus that was on the teeth, and the inflammation that occurred and the bone loss that occurred. That is connected with the teeth mobility that happens as a consequence of that. they're proceeding, I guess, to the other side. Looks like they're scaling the lower, because this is the floor of the mouth right there, and you can see the tongue is retracted, pushed away. This looks like a suction. Oh, not again, not again. Another tooth that is mobile. Now, typically these teeth are hopeless because they lost significant amount of bone support. So they're just popping these things off like it's nothing. So if you're wondering why the dentist does this, it's not only for like a video or documentation purposes. They're also examining the tooth that pops off during something like this. They examine the tooth. It's one of the things that we do when a tooth pops off, or even when we extract or remove a tooth, we examine the tooth, what's the condition of that tooth, and so forth. Did the entire tooth pop off or just part of it? The dentist here is scaling the molar tooth, and look at how that dental calculus can be on the occlusal surface of these molars, i.e. the surfaces that we chew on while we're eating and so forth. It's not a good idea to pop off teeth, so to speak, when doing scaling. The reason some may argue that there will be an extraction socket, and that extraction socket may be exposed to some of that dental calculus, dental tartar falling into that extraction socket, which may cause problems in the future. And it's not only the dental calculus, of course, anything can fall off into that dental socket. Looks like they're going now to we call it the labial surface. Labial surface of the lower front teeth is the one facing the lips. And they're cleaning that labial surface. Okay, the dentist looks like is doing a good job cleaning these teeth. A lot of people think about dental tartar or dental calculus being concentrated near the gum line or near the gum region, which is true to a certain degree, but also dental calculus can happen on pretty much anywhere on the tooth. It's just more commonly occurs near the gum line. That's why there's an emphasis on that region when brushing or flossing. Looks like there's also gum recession on some of these teeth. Again, there are many reasons for gum recession. Of course, it can happen in relation to gum disease as well. Look at how mobile some of these teeth are. Even as soon as the dentist applies that ultrasonic scaler to them. So now they're working on the upper, these are the upper molars, and look at how bad that recession on that molar is showing. The gums do look slightly enlarged and quite inflamed, to be honest with you, a bit swollen. This is actually a really interesting case. So the dental tartar is forming here on the proximal surface, especially if there is a missing tooth or if there is a huge gap, it can form there easily. There's recession here, gum recession. The dental tartar also, as I said, can form on the surface on which we chew on, as in the occlusal surface. It's possible also. I don't know how old this patient is, to be honest with you, but normally gum disease, oh, look at that, that's the other side. That is a whole lot of dental tartar, trust me. That is a lot of dental tartar happening right there. So it's cleaning the molars. Of course, please do not let the dental tartar reach this advanced stage. Visit your dentist regularly for checkups and dental cleanings. Brush your teeth well. Have a look at the ADA, American Dental Association recommendations in relation to brushing and dental flossing and all these things. I think I'll try to put in some useful links in the description you can look at. Oh my god, look at all of that. Dental tartar being pushed and cleaned away. It's crazy. It's actually really sad for me when I watch something like this, as in dental tartar dental calculus really reached a stage like this. I wouldn't let it reach that. Still, we're removing dental calculus from the upper teeth. We're I think the video is reaching near the last phases. Look at how mobile the molars are. It's a very important note. Yeah, I mean, of course, there are different stages, or rather grades, for tooth mobility. There is grade 1 tooth mobility, grade 2, grade 3, and so forth. And the mobility gets worse progressively. I think they will cover this side and they'll just show this at the end. I thought it's interesting. Look at the huge dental calculus right there. And they're like, oh, the tooth is gone. That's all for today. Thank you everyone for watching. Don't forget to like, subscribe, check out the links in the description box. Subscribing, turning the notification bell on helps a lot. Thank you everyone. Dr. Mo Dentist out.